Hello everyone. Today we are going to be talking about ECG, ECG limb bleed or ECG, limb bleed because as we have already known that the ECG leads, there are 12 in number. 6 are limb leads because they are connected to the limbs, that is upper limb, lower limb, while the other 6 they are chest lead because they are connected to the chest. So now we are going to be talking about the 6 limb bleed. Among the 6 limb bleeds, they are divided into 2 categories. The first 3 they are called the bipolar limb bleed, while the second 3 they are called unipolar limb bleed. And why these are called bipolar? Because they are having 2 poles. This we have the negative pole, and then we have the positive pole. Negative pole and then the positive pole. The 3 also negative pole, then positive pole. While the unipolar lead, or to say the augmented lead, because they are called augmented lead. This A is for augmented lead. This they are unipolar because they are only having the positive lead, the positive pole. Sorry, positive. So that's why they are called the unipolar limb bleed. So that's it. But both of them are connected to the limbs in different manner. So someone will ask, how we are recording electrical activity of the heart. So we're supposed to connect these leads to directly to the heart. Why are we connecting them to the arm and then the leg? Because since the heart is producing electrical activity, so the electrical activity can spread throughout the body. So even from large distance away from the heart, we can detect the electrical activity of the heart. So that is it. Because if, for example, someone touch an electrical wire with, for example, with his left hand, if you dare to touch his, even if it is his leg, you can definitely get shocked because all our body is having fluid and electrolyte, and that fluid and electrolyte, they can conduct. They are good conductors of electricity, so they can conduct the electrical activity. So that's it. So it is recommended, even someone who is on ECG machine, it is not recommended for him to be moving his body, because as he is moving his skeletal muscle can also produce an electrical activity. So definitely it can interfere with the electrical activity of the heart that is measured by these leads. So that is it. That is called lead. So now the how the limb lead are connected, it is not prerequisite for you to learn for in learning ECG, but a bit we have to have a great ground knowledge for it. So the lead one is the negative lead. The negative pole of this lead one is connected to the right arm, and then the positive is connected to the left arm. So while the lead 2, the negative pole is connected to the right arm also, but the positive pole is connected to the left leg. While if we come to the lead 3, the negative pole is connected to left arm. The negative pole is connected to the left arm, and then the positive pole is connected to left leg also. So they are connected in such a way that like this. So remember, this is lead 1. The negative lead 1 is connected to the right arm, and then the positive is connected to the left arm. So we have our lead 2 here, and then the lead 2, the negative pole is connected at the right arm, then the positive is connected at the left leg. Then we have our lead 3 connected also like this. So the lead 3 also, the negative pole is connected to the left arm, and then the positive pole is connected to the left leg. So if we can see like this, they are actually producing or creating a triangle, which is equilateral. It's supposed to be equilateral triangle, so don't mind my drawing. And supposed to be the heart put at the center. So definitely the heart is supposed to be at the center. So at least you can get the ground knowledge of how they are connected. And this is not necessary for you now. You have to learn that in the hospital. So now we are going to, this triangle is known as Entwebian triangle. Entwebian triangle. And we have to know that each lead is looking at the heart from its positive side. For example, this lead 1 is not looking the heart from this, but it is looking the heart from the positive side. Like this lead 2 is not looking at the heart from the negative side, but it is looking at the heart from the positive side. That's from the from below. So that's and so on and so forth. So now if you come to the augmented limb lead, that is supposed to, because they are only having positive poles, the AVR, that is augmented right lead, so it is connected only to the right arm, while the AVL is connected only to the left arm. Then while the AVF foot, this F is foot, that is connected to the leg. So that's it. So that's the AVF. So these are actually a kind of this triangle. So that's it. They also are looking the heart from the positive side. So now we are going to look at an important topic, which is called cardiac axis. It's called cardiac axis. So now if we can draw our heart like this, so that's it. So if we can draw our heart like this, so we can see that if we can draw, for example, if we can draw a plane like this, let us draw it here like this. So any number that is above, any angle that is above this line is negative, and then any number that is below this line is positive number. So now this angle here is angle at straight line is 180. Also the angle here is also 180. So now if we are going to draw the straight line like this, so we divide this angle into 90. So this is going to be our 0 degree like this. So in corresponding to from which side a particular lead is looking at the heart, so the lead are also, you can place the lead like this, because we know that the lead 2 is looking at the heart from the bottom, lead 1 from this side, then lead 3 from this side, so on and so forth. And then the most important thing is to remember where a particular lead is looking the heart from. For example, definitely we have our AVF here, we have our lead 3 here. We really have to know this kind of direction. We have our lead 2 here, the lead 1 is connected here, is in here. Then we have our AVR here, then we have our AVL here. So definitely this, we really need to know this. We really have to cram this and then understand it, so that for us to read an ECG. So that's it. So this is our lead 2, this is our AVF, lead 3. If we can count from here, lead 1, lead 2, then separated between our we have AVF in between them, then we have lead 3, then AVR. If we can count them, they are 6 in number: 1, 2, 3, 4, 5, 6. And we have already said that the limb lead are also they are 6 in number. So looking at this, let's say this is our heart at the center. So we are going to be seeing the lead like this. So this AVF is going to be, so this AVF is going to be here, then the lead 2 is going to be here, then the lead 1 here, and then the lead 3 will going to be differently here, and then the AVL is going to be here, then the AVR differently. If you take this drawing and put it like this, and if you take the heart and put it at the center, it will definitely give you like this. So that's it. So and we have already know that the direction of electrical activity of the heart is formed definitely from the SA node that is found here. So if you can take a clock like this. This is 12 o'clock, this is 1, this is 9, this is 3, this is 5, this is 6, so this is 11. So the direction is going as from like 11 o'clock to 5 o'clock. That is from this side, which is the 11 o'clock, you correspond it to the clock, and then to 5 o'clock. So the direction of impulse is going like this through the internodal fibers. And then the atria are also connected through the Bachmann's bundles. So like this. And what determines the direction of the electrical activity of the heart is the thickening, where the which part of the heart is more thicker. The left ventricle is more thicker, so most of the electrical activity will going to be facing toward this side, most of the most strongest depolarization wave is going to be toward this side, that is toward the 5 o'clock. That's why it is called from 11 o'clock then to 5 o'clock. So definitely if we can take this, we will see that most of electrical activity is like this because the left ventricle is thicker. So any condition that may make the right ventricle to become more thicker than this, definitely this will shift to this side. So now the electrical activity will going to be more at this side. So that is it. So the average of, and that doesn't mean that the electrical activity is not going in the so many direction of the heart. So but only that it is strongest at this direction. So that's it. So now we are going to be talking about the axis actually. So like this. For example, if we have another heart here, like this. So it is at this direction. So if impulse is triggered from this SA node, definitely the atria has to be depolarized first. The atria has to be depolarized first. If the atria are depolarized first, definitely our P wave has to be first created. So each kind of lead is recording its own P wave, is recording its own QRS complex, and it is recording its own T wave. Each lead, definitely. So, and we have already known from the previous ECG lectures, we have already known that if a particular lead, the electrical activity is going away from that lead, so that lead will definitely show a negative deflection, or that is inverted. The P wave will be inverted, the QRS complex will be inverted, so T wave will also be inverted. But when a particular lead, the impulse is going toward a particular lead, so definitely that particular lead will be having a kind of positive, that is the P wave will be upright, QRS complex will be upright rather than to be inverted. So that's it. So now in the next video we are going to see how each lead, particular lead, show it on kind of Q wave, then P wave, then that kind of things.